My favorite prenatal success story was probably a woman who came in and she was about 30 weeks pregnant and she had a breech baby. And our goal typically during chiropractic care is really not to flip the baby because we don't practice obstetrics. Our job is to open up that pelvis and that sacrum and make sure things are moving well so that the baby has enough space to turn if they can turn. So she primarily was here for a breech baby, but we were doing all the things with Webster technique, and so making sure that pelvis was nice and open and mobile. And at 37 weeks or so, she had a baby that had flipped, was head down, and was able to have a regular vaginal delivery.
We see a lot of pregnant patients here. They come in for a variety of reasons. Midway through 25-ish weeks, 25 to 30 weeks, we'll see some pain starting to develop. 60 to 70% of all women experience low back pain at some point in their pregnancy. And so, we see a lot of women with that low back pain into the pelvis. We also see some mid-back pain, maybe some rib pain, either in the front or the back. We see a lot of hip pain. The baby is kind of like sinking down into that area, and so hitting all of those muscles and stuff like that, that's going to cause a little bit of pain.
Prenatal chiropractic typically starts off with a full examination. So we're going through your past health history just like normal. If you've had any pregnancies before, if you've had trouble conceiving, that kind of thing. And then after all the questions are done, we will do a physical exam, look at range of motion, do just your typical test to provoke the pain and see what the pain generator is. And then after that, we do some treatment. So that looks a little bit different during pregnancy just because things are a little bit more sensitive. And so you don't need a lot more pressure. You need less typically in pregnancy. So it's gonna look like some soft tissue work and some adjusting, and that's gonna be lighter than what you are typically used to during a regular treatment when you are not pregnant.
I particularly like to focus in on the psoas. It's a muscle that brings your knee up to your chest, and it's also a muscle that the baby is kind of sitting right on. And so it gets a lot of abuse by the baby, whether the baby's sitting on it or punching it or kicking it. And so we like to try and loosen that up.
Postpartum care is important, in my opinion, because I feel like we don't get enough attention after delivering a baby. We typically only get one 6 to 8 week follow-up, and then they send you off and say that you are perfectly put together and you are fine. So here we can give you that attention that I feel like you need. You need a lot of emotional support after you have a child. There's a lot of hormones that are shifting in your body, and there are a lot of emotions and whatnot that come into play after you deliver a baby. So not only that, but just physically, you do need a lot more attention. You just delivered a baby, whether that was via C-section or regular vaginal delivery. There's so many changes that take place. So we can look at your C-section scar, and we can mobilize that scar for you if you feel uncomfortable doing that. And we can work with you on how often you can come. I know it's a busy season after you have a baby, so you don't need to come weekly if you can't do that, but just coming as often as you can, I think will be helpful in the long run. There are various reasons why pediatric care is important. I would say for infants, there's usually a core reason why you are bringing your child in, which is like working on feeding or working on latching, that kind of thing, or helping decrease colic and whatnot. But I would say regular pediatric care is pretty important after falls, big falls down the stairs. That's pretty common actually to see in toddlers, or falling off the playground, that kind of thing. Just making sure that that child is nice and mobile afterward, and things are not technically like out of place, but just making sure things are moving better after a big event such as that. Pediatric treatment looks different across different age groups. Infants looks very, very different than what an adult would look like. But typically we are doing an examination in the mouth primarily. And so we are loosening up those tissues, loosening up the tongue, and any like oral tethers in the lips. And then also just like loosening up the jaw and the entire body as well. So a lot of just fascial work, which is very, very soft and very gentle. Ages 2 and up is also a little bit different than that. We are using the activator typically, and that just looks like a little adjusting tool, and it's very pinpoint, very fast, and very little pressure. So that's what ages 2 and up looks like. But we also do a lot of soft tissue work too, craniosacral, which is just very gentle pressure points on the skull and on the sacrum as well.
Typically, Dr. Asia will see all the patients probably from like 4 years old and younger. Anything over that, I'm comfortable seeing. Typically, it's after a big fall at school, or playing too hard on the soccer field. And so I loosen up muscles. I make sure that they're balanced. I make sure that their joints are all moving correctly. Those kids move so much more than adults, and so a lot of it is just really gentle adjusting, a lot of activator technique, which is a really light form of adjustment, and that helps the kids feel quite a bit better. I typically don't see kids for that long. They typically get better pretty quickly. The clinic has improved tremendously since hiring Dr. Asia. She has been such a huge blessing to me. I truly could not have done any of this without her. She filled such an important gap in treating people who want a female provider, who want someone who can treat their kids. And I can't do that. That's not my passion, but it's her passion, and I am so appreciative of that. I think she brings so much to the clinic, and I'm so grateful that she's here.
Aww.
Aww.